I want to talk a few minutes about antibiotics for early Lyme disease. There are 3 antibiotics: doxycycline, 100 milligrams orally twice daily for adults, and then amoxicillin, 500 milligrams 3 times a day, and then there is cefuroxime, 500 milligrams twice daily for adults. Now, what is the duration? Most of the trials of therapy for early Lyme disease usually a treatment duration of 21 days. Now, however, other trials of doxycycline have shown that 10 to 14 days of therapy is as effective as prolonged therapy. For erythema migrans, that is the early Lyme disease in the United States, the best data about the relationship between treatment duration and efficacy come from a randomized double-blind trial in which 180 patients with erythema migrans were assigned to one of the 3 treatment groups. In one group, they have 10 days of doxycycline. In the other group, 1 dose of intravenous ceftriaxone followed by 10 days of doxycycline. And then the third group, 20 days of doxycycline. Efficacy was assessed at 20 days and at 3, 12, and 30 months. There was no significant difference in outcome among the groups at any of the follow-up time points. One of 61 patients who received 10 days of doxycycline developed Lyme meningitis at day 18 and was successfully treated with 2 weeks of intravenous ceftriaxone. So the duration of therapy it varies. It was evaluated in Europe, where most cases of erythema migrans are caused by Borrelia afzelii, which does not usually disseminate. But in United States, Borrelia burgdorferi infection can disseminate. A trial is always important. So you see, in the duration, even 14 days is as effective as 21 days. Then the recommendations. In keeping with 2006 Infectious Disease Society of America guidelines, there are a few recommendations. Remember 3 drugs: amoxicillin, doxycycline, cefuroxime. Doxycycline is generally preferred because it is also effective against human granulocytic anaplasmosis. However, doxycycline should be avoided in pregnant women and children under 8 years of age. That's an important point. Don't give doxycycline to pregnant women and children under 8 years of age. Then amoxicillin or cefuroxime is preferred in those patients. Doxycycline should be given for 10 to 21 days. Amoxicillin and cefuroxime should be given for 14 to 21 days, depending upon the response to therapy. Among patients with early disseminated disease, doxycycline for 21 days in patients who have no neurological disease other than isolated facial nerve palsy is advised. Although ceftriaxone is as effective, it has this disadvantage because you have to give through an IV line. So that is a disadvantage. It's better to give doxycycline in early Lyme disease than intravenous ceftriaxone. So some of those basic points I wanted to share with you today. Thank you very much.